excellencies and distinguished guests present here. And it's an indeed pleasure to welcome you all to the eighth session of our highly engaging e-webinar series, Adolescent Counseling, Basics and Beyonds, organized by Chhattisgarh AHA, well advised, proposed and conveyed by Dr. M.K.C. Nair sir, Dr. Preeti Galagali ma'am, and Dr. Kavita Menghani ma'am. We are fortunate to have some of the distinguished personage in pediatric and adolescent health with us today to guide us through this enriching session. I am deeply honored to welcome our guest of honor for today's session, Dr. G. Malini ma'am, former head of Department of Pediatrics and Director of JLN Hospital and Research Center, Bhilai. Presently, ma'am is in Madurai, Tamil Nadu. It is my pleasure to welcome our distinguished chairpersons for today's session, Dr. A.P. Sawant sir, Senior Consultant Pediatrician and past Chairperson of CGAHA, and Dr. Namita Srivastava ma'am, Senior Consultant Pediatrician and past Secretary of Chhattisgarh AHA. We are grateful to have you all with us today. It is my privilege to welcome our esteemed speakers for the today's session, Dr. Himabindu Singh ma'am, Chairperson-elect of Central AHA. She will be sharing her valuable insight on premarital counseling, and Dr. Preeti Galagali ma'am, a renowned adolescent health specialist. She will enlighten us on life skills-based counseling. I would like to welcome all the esteemed members, Dr. Dapke sir, Dr. Geeta Patil ma'am, Dr. Atul Kanikar sir, Dr. M.K.C. sir, Dr. Sanjay Agrawal sir, Dr. Nishikant sir, Dr. Ashok Sundaran sir, and all the members present today for the session. Now, moving ahead, it's our honor to have with us as our guest of honor, Dr. G. Malini ma'am, whose remarkable contribution to pediatrics in Chhattisgarh have inspired so many. May I kindly invite ma'am to share her thoughts with us.
Good evening, ladies and gentlemen. It's indeed a privilege to be a part of this event with the stalwarts and pioneers of adolescent health. As adolescence is a unique stage of human development and an important time for laying the foundation of good health, this e-webinar series on adolescent counseling in office practice, basics and beyond is doing a good job of priming all the pediatricians with basics of counseling by giving practical tips and techniques of adolescent counseling. These sessions by learned faculty are informative and power-packed. The case-based discussions and role play are eye-openers. The success of this program can be judged by the number of people who join the session for listening to the eminent speakers. We have to congratulate the organizing team for this e-webinar, especially Dr. Kavita and Dr. Shilpa, whom we see every week. But there are many unseen hands who have helped to bring this academic feast for us, and I thank them also. Adolescent care is an integral part of our pediatric care. Chhattisgarh Academy of Pediatrics and Adolescent Health Chapter are doing excellent work by organizing such wonderful, thought-provoking sessions. I wish them success in this venture. And thank you once again for inviting me for this session. Now I hand over to Dr. Shilpa.
Thank you, ma'am. Thanks a lot for your enriching words. And may I now request our Honorable Chairperson of Central AHA, Dr. Geeta Patil ma'am, to address the audience with her message.
Thank you, Dr. Shilpa and Dr. Kavita. I think let us congratulate Chhattisgarh Adolescent Health Academy. Just now, Dr. Malini madam has told, there are few people who are seen and there are many who are behind, who are helping for this program, and many people are attending that. I think let me first think myself, I was not very clear about premarital counseling. But once I read the book Premarital Health Counseling by our guide and mentor, Dr. M.K.C. sir, everything got clear. And I understood that it is not about preparing them for immediate marriage, but rather about equipping them with life skill and emotional intelligence for the healthy future relationship. That's all, many things I could understand. And we have got an expert, Dr. Himabindu madam is going to talk, and later on, Dr. Preeti madam also is going to talk about the life skill about that. Without much wasting time, let me thank again and let us start learning. Wish you all the best. for arranging this counseling session. And this is very important topic. As such, many of us are not clear about that. And today we will be clear about that, how it is required for adolescent specialists, this topic. Thank you very much.
Thank you, ma'am. Thanks a lot, ma'am, for your words. And I would like to invite our esteemed chairperson, Dr. A.P. Sawant sir, to offer his insight to the audience and introduce our first guest speaker for her session.
Good evening, everyone. It's really my pleasure to welcome all seniors as well as guests in this program, and I am privileged to chair this session. Earlier, as Dr. Geeta said earlier, I was also not very much sure about the premarital counseling. When I go through the literature and some of the things, then I came to know that it's a type of therapy that helps couples prepare for marriage by building a strong foundation for their relationship. And it helps in couples in many things: improve communication, resolve issues, understand each other, prepare for future adjustment for other family, learn for and other challenges. But Dr. Himabindu is a very learned, and will definitely clear all doubt on this issue. Dr. Himabindu is well known to all of us, but still she is a very renowned person in IAP as well as adolescent health. At present, she is the professor of pediatrics and additional medical director of Telangana State. She is the chairperson. She is the chairperson elect CAHA, National Joint Secretary at present, IYCF 2024. She is the president elect CAHA 2024. She is the future of our adolescent academy. She was the founder chairperson AHA Hyderabad, president Indian Academy of Pediatrics Twin City branch 2013, president Pediatric Academy of Telangana State 2018. President NNF Neonatal IAP AP State 2008, Executive Board Member 3 times, 2008, 2014 and 2015. She is the National Convener and Chairperson of Indian Academy of Pediatrics of Women's Wing 2016 to 2019 and 2022 to 2023. She is National Faculty and Organizing Secretary in many of the conferences and everywhere. She had many publications say she at least at present she has 64 publications for national and international journals. For this, I invite Dr. Himabindu to deliver her talk.
Thank you so much, Arvind Prakash Sawantji. Before I start my session, I would like to really thank our Chhattisgarh Academy of Adolescent Health, Dr. Kavita and Shilpa, and IAP Chhattisgarh, and all the seniors who are attending these sessions. Before I start, I would like to take blessings of our mentor, Dr. N.K.C. Nair sir. Sir, happy Onam to you. And in spite of your busy family schedules, you have accepted to come over, because we have done this preconception care module under his guidance, and we had many programs in 2022 throughout the country. I think it's the first time we have developed some guidelines on preconception care. It was published in Indian Pediatrics too. Over to you, sir, for a few words of your comments, and then I will start the session. N.K.C. Nair, sir.
Good evening to all. I started premarital counseling many years ago because of 3 specific reasons. Number one, if you had a child with behavior problem in my child guidance clinic, which I have been running for 44 years now, and having seen more than 75,000 families, I've realized the children have problem because there is a problem between the husband and wife, not necessarily divorce or serious issue, medical, legal issues, but it is just they are not in terms with each other. They are not gelling well. That is the whole thing. When we did a study on teenage pregnancy, the first thing that came out again was, apart from poor parenting, was again the emotional disconnect between parents. The odds ratio was 7. That means 7 times more chance for a girl, to become unmarried pregnancy. And the third one, of course, is the reason is because there are lots of children have small psychological issues which never get diagnosed. You go and see the family, you look at the horoscope, you talk about the 4-digit salary, all that, but we don't look at the mental health of either the boy or the girl, and the person is put into innumerable problems across the stage. And sometimes it can be so silly, sometimes it can be very, very bad. Like the silly one, I'll tell you, a girl who had come for premarital counseling, then after 10 days to 15 days, she said, I want to come and see you. I said, okay, why not? Come with your mother. She said, no, I will come with the husband. She insisted. I said, okay. What is the problem? Yeah, the problem is if he touches me, then he will go and take bath. Am I such a dirty girl in the street that he has behaved like this? So immediately I only asked one question, how much soap he will finish? One bath he will finish half a soap at least. So what is the diagnosis? Simple OCD. Okay. All I had to do was tell her that, it is something called OCD. She said, do you need medication? I said, you can manage without medication. Otherwise, lifelong he has to take it. Okay. So I explained her the situation, just try to understand what is his problem. Then she said, okay, he thought I was such a dirty girl, something like that. So some silly things to a serious one, which I'll tell you in a language that is appropriate, although I'm sure you'll understand what it means. A girl got married, and all she knew about marriage was what she has seen in the movies, two birds doing like this. That's all. She had no idea about sexuality and all that. Nothing. Okay. And what this man has done on the first day itself was something like, the people, who put the sword down the throat. Have you seen that? They can put a sword down the throat. He did something similar to that. I won't use the exact word, but I suppose you understood what is. The poor girl started gagging, making, and the whole lot of noise. She was taken to a psychiatrist who surely gave her risperidone and all that. The mother was not convinced, because then she came to me and I just asked the girl what happened. She told me the incident. I said, Beta, it was very unbecoming of you to do that. But, then again, I started counseling her. It's okay. So not only premarital, immediate postmarital also comes in the premarital counseling. In my book, I have given 10 commandments for that. I won't describe all that. Adolescents, you need family life education. Preschool. The school days, you have to do family life education. Then you have to talk about mental health screening, reproductive health screening, and life skill education. And some little bit on sexuality, to summarize the whole thing, and you will be able to do a good premarital counseling. The module has been done by eminent people. I have gone through the whole thing, so I know it has come out very beautifully, lots of information, and Himabindu has spent her whole last year on this one, and I like to congratulate her for an excellent job on the module. Thank you.
Thank you. Thank you, sir, for your blessings. And without you, we can't, this was something, a very new subject. And we have spoken about premarital counseling. Sir has introduced that concept. Now we moved further, instead of just saying marital, without preconception counseling. So next slide, Dr. Kavita. So the preconception care was introduced, and this was to move, to sort of orient our young adults and adolescents. So once they are a little older and they are planning to get you conceive, and sometimes they conceive intentionally, unintentionally. So please go back till I said don't. So we wanted to introduce the importance of preconception care. So it's a very bold topic because even when we talk about sexual education, people are not receptive, though we are trying to push in through AHA Academy also. But preconception care is again a bold subject where nobody has touched in. Even the FOXY or the Gynecological Society, they have not spoken about this. So we pediatricians who are taking care of young adults too, up to 24 years, I think we are the most appropriate persons to get this clinics established. Even PCC clinics should be established, I think, throughout the country, because this is extremely essential. So in this, because a very huge topic, but I try to condense because I have to finish in the next half an hour. So I will talk a little bit about the optimum age of pregnancy, and then what is the nutrition should be during the preconception care, what is the ideal body weight they should maintain, and special focus with folic acid and the vaccinations, what they need to take before they want to conceive. And some knowledge that the adolescents need to know about genetic disorders and how to be eumetabolic before they are planning to conceive, screening for infections and other disorders, about the importance of lifestyle, healthy lifestyle, and other concerns, dental and body image issues. Next. So this will be talked, and I want to also cover the mental well-being. Just now, Dr. M.K. Sinara has just mentioned how important it is before they want to conceive. Both the couple need to be mentally well, and we have to screen them for various disorders before they conceive. Then importance of medications and avoiding substances, and the importance of reproductive health, both male and female, and how to maintain good, meaningful relationships, including sexuality, skills, and of course, a very good support system is extremely essential for the couple before they want to conceive. Next. So to introduce what is PCC, so preconception care, we wanted to tell the young adults because we want to take this knowledge to the schools and colleges, maybe universities, little older adolescents. So when we say preconception, it's a technical medical word. So we wanted to call it prepare, to create, and care. So just preconception care is actually the care a couple receives before getting their baby or conceiving their baby. It should be started as early as 4 months before pregnancy. It's not just that immediately. They have to plan at least 4 months before the pregnancy. So this whole knowledge should be targeted for the teens and young adults. And I think they will receive this knowledge through whom? We, the pediatricians. We have to empower ourselves first and to empower the young adults. And of course, we can work not just in schools, colleges, we can also work with the ASHA and Anganwadis who are in the community to empower other adolescents and young adults who are in the community, not going to school. Next. So this is very much needed. Why? Why do we require a preconception care counseling? Because these are the glaring statistics. 4 out of 10 women are reporting that their pregnancies are unplanned. This is really very much, very scary. We plan everything in life. We want to become doctors, engineers. We plan for everything. For every small thing we plan. But why not for such a big task that we are creating babies, we are creating conceptions, we are conceiving, but there's no plan for this. So 40% of women report unplanned pregnancies. Undernutrition and iron deficiency anemia in the mother increases the risk of mortality of almost 20%. So it is very important that we take care of the girl before she conceives. Her nutrition and especially the iron deficiency should be treated. And deaths around birth are 50% higher among children born to mothers under the age of 20. So and we don't want teenage pregnancies because of this alarming statistics. 50% deaths around birth are because of the mothers below 20 years. So therefore, a preconception care is extremely needed. Next. It also determines the first 1,000 days of life. So we have spoken a lot over the last few years over the concept of 1,000 days. In fact, in 2018, we started Lakshya 1,000. It started from us. And then, of course, we have the ECD, very big program run by the IAP. But even before 1,000 days, now I'm saying this 1,000 days plus program. That is preconception care should be started 4 months before this first 1,000 days. So it prepares you for the first 1,000 days. So you can see that 1,000 days pregnancy and then year 1 and year 2. So for preparing for this 1,000 days, we need to prepare at least 4 months ahead. Next. This program will establish healthy lifestyle behaviors for both the girl and the boy, the couple. It will identify and treat risk factors, prepares the people psychologically to care and create, and ensures the best start to the next generation. So we are next clicking on. So teenage pregnancies are very, very rampant in India. We know the statistics. So we have to take care that we avoid the teenage pregnancies, and we advocate that the optimum age of pregnancy is between 21 to 35 years. So the teenage pregnancies there are many millions, 11.8 million teenagers are getting pregnant. And this is very, very glaring statistics. And we do not want children, we call them children, below 20 or 21 to become pregnant. So we need to talk about the optimum age of pregnancy. Next. So this is mostly, the young teenage pregnancies are often unplanned, mistimed, and unwanted. So we want a planned pregnancy. We all know why the teens are getting pregnant. Lack of information. They do not even know. Most of the couple after marriage or when they conceive, they don't even discuss. In fact, I run a center called Yuva in Hyderabad, and this is a government center. Over last many years, we are doing that. I've seen many cases of girls who get pregnant at even 13, 14. And then when I ask them, they say that we do not know that intercourse will lead to pregnancy. So all the time we are teaching them about the reproductive system with the ovaries, and now we tell them this is a uterus, and that we only talk about menstruation and menstrual hygiene. But one thing we are not able to tell them is maybe that's not going to they are thinking with that so important thing that they're ovulating. And the boys have sperms, the girls have ovum. So when there's a likelihood of pregnancy during intercourse and there's the exchange of fluid. So this basic information we are not able to say because we are not able to talk about intercourse and how actually children are getting created. So there's lack of absolute information about pregnancy, about how a conception happens. So because of that, the teens get pregnant, whether it is planned or unplanned or before or after marriage. And peer pressure, curiosity to experiment, all these are there these are innate behaviors in adolescents. And early marriage and liberal views on sex and sexual abuse, these are the various concepts in teenage pregnancies. But you can see the after effect. There can be many problems with teenage pregnancies. Next slide. So it affects both the mother and the baby. So we need to prevent it. And how do we prevent? Because we know that small babies, low birth weight babies are not healthy for us. So we have to somehow prevent the teenage pregnancies through education, through empowerment, and making the adolescents or young adults make well-informed decisions. There should be access for knowledge and access for sexual reproductive health knowledge. Increased access for effective contraception should also be there. We should be very, very bold. We need not hesitate to talk to them about contraception too. I think we have to really break those myths, and we are going to take the sexual wellness in a very big way the next year also. And we have to be they are very receptive. Adolescents want to know, they're very curious. So if you do not talk to them scientifically, they will have access to other sources. So let us give them proper knowledge about contraception. And we should not talk about marriage, whether they are married, not married. We are not going to be moralistic or preach them. It is their own values and culture, but at least let them talk. Let us tell them about how to have a safe sexual behavior. And preventing marriage before 21 years, we have this legal age of marriage at 17, 18, but I think we should postpone it to 21 and 24. And preventing sexual domestic violence and good family support, all that will prevent teenage pregnancies, including family life education and life skills, emotional, cognitive, interpersonal skills. All these life skills will help prevent teenage pregnancies. So we also have to talk to them about delayed pregnancies. At one end, we have, children who we don't want teenage pregnancies, but young adults are now are postponing their pregnancies. That is other problem, especially in metros and highly educated couples. They do not want to even get pregnant. They are delaying pregnancies, do not want pregnancies. They are even afraid of bearing children. So this can, the delayed pregnancies can have its own problems, infertility and financial insecurity, fulfillment and personal goals. And, so we have to talk to them not to delay beyond 35 years also. Next. So complications are there with delayed pregnancies also. We have to let the young adults know about all these complications. Now coming to nutrition. So we have spoken about the right age for pregnancy, between 21 to 35. And now next, let us talk about what is the proper nutrition the couple should be having 3 to 4 months before they want to conceive. So the basic thing is a healthy diet will lead to healthy ovum and healthy sperm and lead to a healthy baby. We should start at least 3 to 4 months before they plan for pregnancy. The girl should have a proper balanced diet, maintain ideal BMI, body mass index, and look for anemia and treat it. And they have to, of course, avoid junk foods and take only healthy foods, good micronutrients and water intake. On the right side, we can see the nutrient values. Folic acid recommended is 400 micrograms. Vitamin D, calcium, iron, and iodine. These are very, very important micronutrients. Iodine 150 milligrams daily, iron 15 to 18 milligrams daily, calcium 1000 milligrams, vitamin D 600 IU daily. So these are the RDA recommended allowances for a woman who wants to bear a child. So this should be ensured at least 3 to 4 months before pregnancy. So for the preconception nutrition care, healthy diets should be advocated. Information, education, counseling should be given to the couple. And fortification of the stable foods can, through all these other methods also we can ensure. And we also have to ensure physical activity. It's not about just eating. We want them to be healthy, fit, and so promote exercise and physical activity for all these couples, especially the woman. Supplement with iron folic acid. We all know that should be around peri-conceptional, so not just after conceiving. It's a very, very unfortunate that they come with missed periods and it's almost 4 months or 3 months. We have lost the critical period where neurodevelopment is happening, neural tube development is happening, and we miss the bus. So we have to give routine iron folic acid for at least 4 months before they are planning pregnancy. Screen for anemia and treat. So that is a food pyramid. Now we are showing the food plate, the healthy food plate for the girls or the, next, for the women who want to conceive. And iron, I want to stress on the iron folic acid supplementation. This is launched by the ministry. We all know that. So this is for reducing the prevalence and severity of anemia in adolescent population. This is going on 100 milligrams of elemental iron or 500 micrograms folic acid. We should continue even before the preconception period. Next. Vaccination is another one important thing. So before they conceive, we have to talk to we have to tell the young adults, especially the girls, to take all these vaccines. Remember, vaccine is now being frequently given in younger age group. In case they are not taken earlier, we should give 2 doses about 48 weeks apart. And Tdap, influenza, hepatitis B, HPV, COVID vaccines, all these vaccines are recommended vaccines before they want to conceive, they're planning conception. We have to follow the doctor's instructions. We all can give that in our clinics. Next. If they're not vaccinated earlier. Especially the rubella vaccine, extremely important because we know the congenital rubella syndrome has a lot of problems. If infection occurs during the first trimester, and it can lead to a lot of congenital defects. So pregnancy, in case the vaccine is given, then they have to avoid pregnancy for 3 months after the vaccination. And the ACVIP recommends the use of MR or MMR vaccine instead of only monovalent rubella. And this is recommended to all children. 3 doses are recommended 9 months, 15 months, 4 to 6 years. So that is if they are taken earlier, no need to give now. But if they're not taken, we have to give a catch-up dose. 2 doses should be given. Next. Knowledge about genetic disorders also should be given to the couple. So what instead of हम लोग कुंडली देखते रहते हैं, we look at the height, weight, की अच्छी है, beautiful है, what is the कितना पैसा है, what is education, that we are looking when we are doing match fixing, or when we want to look for our boys and girls prospective partners. But I think it's important to also take good family history of metabolic disorders or any genetic disorders also, because genetic disorders can be prevented only by preventing transmission. So we do not have a cure for genetic disorders. So cognitive deficits can happen, developmental delays can happen, and eating, digestive issues, speech problems, and then limb facial abnormalities, cleft lip and cleft palate, and movement disorders, neurological issues, short stature, vision and hearing loss. All this can happen due to some genetic disorders. So this has to be prevented by counseling. So how do we identify? So for the couple, we need to tell them, take the family history. You can, if you suspect, you can do a DNA testing for genetic disorders before they start the family. Career testing can be done, prenatal screening, prenatal diagnostic testing, and newborn screening after the child is born. Next. So depending on what you're suspecting. So most genetic disorders do not have a cure. We all know that. So some have treatments that may slow the disease progression, but it's better to prevent it than managing it. So provide a medical surveillance if you, in case it is born, then at least catch them early to prevent complications, and do a genetic counseling for the next pregnancy. Next. That is the genetic disorders. Now we need to do metabolic syndrome identification. So we have to identify a metabolic syndrome. which is already started before the girl is want to conceive. So how do you identify this? One slide I put it. So just look at the waist circumference. It is more than 102 centimeters or 40 centimeters in men and more than 88 centimeters or 35 inches in women. So that is very important indicator. Look at the triglycerides. If it's greater than or equal to 150 milligrams, this is one indicator. Reduction in HDL less than 40 in men and less than 50 in women. If blood pressure is greater than or equal to 130 by 85, an increase in blood glucose more than or equal to 100 milligrams per dl. So this can identify metabolic syndrome. So by just keeping these parameters, we can identify whether metabolic syndrome is there or not in the girl. Next. So the prevalence of metabolic disorders is really increasing. Gestational diabetes affects 5 million women annually. There's an increased incidence of preeclampsia also, and prevalence of metabolic syndrome reported to be 35% in a PIH and 30% in preeclampsia. So results of meta-analysis have shown prevalence of hypothyroidism to be 11.7% in India. So to prevent all these disorders, we need to manage them and identify so that it don't transmit in the children. Next. So gestational diabetes, we all know it causes a lot of problems. It's a leading cause of premature births and infant mortality. And main factors to predispose GDM are high caloric intake, lack of exercise, and environmental factors. All this can be managed before. So if you can do a good lifestyle modification, if you take care of your diet, manage your metabolism, then conceive the baby, that is a better way to so that the child is not exposed to a bad intrauterine environment. Next. So influence of maternal lifestyle is also there on the baby. So even though there's a genetic predisposition, you can modify the genetics by modifying the epigenetic factors, the environmental factors. So that is what is in our hand. We cannot actually take care of the genetics, but the pre-pregnancy, obesity, and insulin resistance can be managed. You can see this, the maternal lifestyle during preconception and gestation, how the woman can actually modify the environmental factors so that the intrauterine, when she conceives the baby has a proper, the mother should be in a eumetabolic state, because the child can be affected and long-term problems can be there for the child later on. Because the epigenetic modification can happen. You can see that the DNA methylation, this can happen when the epigenetic modification can actually modify the DNA. So it can go to that extent. So to prevent this, you have to take care of the epigenetic, that is the nutrition, the lifestyle, all those things, so that you reduce inflammation. Even the nutrition, what you take, that the gut brain, we know that gut microbiome inflammatory, these are all new avenues. We are all learning about it. So it's very, very important that she has a proper lifestyle before she conceives. Next. So healthy lifestyle is very, very important. To keep fit and energetic is very important. Reduce the risk for disease. And you should be a role model for your other people. In the preconception period, the purpose is to get a healthy baby and to prevent fetal onset adult diseases. Next. So we advise exercise and to bring down the obesity rates. Actually, obesity rates are really doubled in the last 30 years. There are a lot of complications, both maternal and fetal. And you can see these complications: hypertensive disorder, gestational diabetes, induction of labor, cesarean section, fever, PPH, preterm deliveries, all these are there for the maternal side. And the fetal side also, the obesity, a lot of problems, a big baby, stillbirth, and a lot of neonatal deaths are also reported, miscarriages, etc. So we want to also prevent this obesity issue. Next. So to reduce the incidence of obesity, we know the role of diet and physical exercise. So we have to measure our BMI before conceive and try to bring down by taking care of your diet and modify your lifestyle. So eating healthy, and we know including fruits and vegetables, and half of the plate should be vegetables and homemade food. And we advocate physical exercise, have a good sleep hygiene, and stress management and positive attitude is a very important part of having a healthy lifestyle before you conceive. Next. So body image also matters. So because we all know overweight and obesity can lead to PCOS and in fact affect the conception. There will be a problem to conceive. Infertility happens. Body image also is important for attracting to opposite sex, interpersonal relationships. are important for conceiving the baby. So therefore, having a good body image is also important. So poor body image can lead to mental health issues, poor self-esteem, anxiety, depression, etc. So therefore, having a positive body image, a right body image is very extremely important before conception. Next. So, we can move on. Next. So accepting the body, liking your body, taking care of your body. That's what we want to tell to our young adults. So in case you're really working hard and still, we need not body shame them, but you should like your body, take care of your body, accept your body. No, they all will not be fair, all will not be, this thing. So whatever you are, you can be still attractive. It is more of the other factors are also there. We need to tell them when we talk about interrelationships between the before they have all these issues, complications before conception. So the other complications of body issues can be eating disorders, major depression, suicidal thoughts, and substance abuse. All the other issues are also there. So the body image issues are becoming extremely important. They're coming in the way of conception. Next. So they go for cosmetic procedures. This is very much seen in metro especially. They want to look best before and attract the opposite sex and maybe acne. There are a lot of they're going for procedures, breast augmentation, liposuction, having fillers, and rhinoplastic tattoo removing. But we do not advise all these things. We tell the young adults to accept what they are and because these things, more than this, the other things matter. So that's what we want to tell them. Yes, next. So maintaining a proper dental hygiene. This is another aspect. So I'm just putting all the things, various conditions which are related to preconception care, because studies have shown that improper dental hygiene can lead to premature deliveries. So it is very imperative part of preconception care. Next. Mental well-being, extremely important part of preconception care. 20% of women are experiencing mental health condition. Before, during, and after pregnancy, they have some issues. So antenatal depression and anxiety can lead to adverse obstetric outcomes, especially placental insufficiency, preterm labor, and low birth weight. Children of mothers who have depression or anxiety are more susceptible for ADHD, conduct disorders, and emotional problems. So supporting mental health helps the woman to make informed choices about their reproductive health, fertility, future pregnancy plans, and mental health. So extremely essential that both the couple are mentally well. Next. So how do we ensure that? So we have to look into the factors. What is affecting the mental health of a couple? So there could be individual factors, relationship issues, and social and environmental factors. But prevalence, these are the facts. Prevalence of perinatal depression is very, very high. In India, it is estimated at 22%. And a recent study estimated the prevalence of generalized anxiety disorder of 23% among perinatal women. And another, study has estimated 7.6% women in India experience suicidal ideation in pregnancy. So these are somehow we don't talk about it. We all think pregnancy is all about celebration. But, women could be depressed, could have anxiety. We need to take care of our mental health before, during, and after pregnancy. Next. So we have to do this head screening for the young adults, as we usually do for all adolescents. In addition, we have Indian screening tool for mental health, like the TSQ. Some of the tools are there. The health questionnaire, parental health questionnaire 2-9, and we also have generalized anxiety disorder scale GAD-7, scale for assessment of somatic syndromes, and Ask Suicide questionnaire. Checklists are all available. We can all use this. Next. So for mental well-being, screening we can, as adolescents, let us screen when they are planning for pregnancy. So whether screen for anxiety, depression, suicidal ideation, and stress management by various tools, which we just mentioned. Look whether they have any risk factors. Then we also have to assess about their mental health during preconception, pregnancy, and postpartum too. Next. These are the validated screening tools. Next. Coming to substance abuse, another adverse effects on the young adults when they want to conceive, we have to ensure that they do not have any substance abuse. It really causes a lot of problems, teratogenicity, growth restriction, and low birth weights, and then mental handicaps, poor attention, all this can be there. So let's move on. Let us look at how we can avoid. Alcohol is one major substance abuse. Though we may think that women do not take, but we are in the villages, in remote, in Telangana, at least my state, I think it's very, very common for both men and women to take alcohol. They take in different ways, toddy and other things in all celebrations. And any type of alcohol is bad, even a small amount, and it may contains ethanol. And the consumption of these drinks actually plays some social functions are there. So we have to look at the adverse effects, look for the male and the female and the fetus, what happens. For the male, all these problems can happen. Decreased sperm count can happen, motility, decreased seminal volume, abnormal sperm morphology, and it can damage the sperm DNA. Do the men understand? Do the boys understand that it can damage their sperms? It can also damage their ability to even do erection or even intercourse. So this has to be told to the men. For the female, abortions can happen and of course depression. See the adverse effects on the fetus. The child who's not even conceived or maybe is in the fetal stage. So alcohol can be a teratogen, can lead to prematurity, neural tube defects, esophageal atresia, fistulas, long-term neurodevelopmental deficits, fetal alcohol syndrome, and decreased brain volume and long-term learning deficits and abnormal corpus callosum. Lot of adverse effects on the brain. Next. So no amount of alcohol is accepted and this has to be completely stopped at least 4 months before they are planning to conceive. We also have to tell our young adults, say no to drugs, avoid smoking, caffeine and alcohol, and promote proper healthy lifestyle choices, and no smoking, no drugs at all. Next. Even smoking is very bad. Psychosocial issues, we have to tell them, please seek help. If these are the, we just in the OPDs, we can ask them, are you feeling low, lack of interest in anything, anxiety, suicidal thoughts, any other stressors? We have to encourage them to seek help. Next. Reproductive health female is very, very important. So the girls have to take care of their reproductive health. So the womb may be more important than the home. This is what Dr. David Barker has said. The womb is where the fetus is being created, the future baby is being created. So that is more important than the home. So please see that the reproductive tract is healthy. So we have to tell them about the various abnormal things. Uterine bleeding can happen. When there's abnormal uterine bleeding, there could be all these issues, polyps, malignancy, coagulopathies, all those issues. They have to be treated for all this. And what are the red flag signs when there's a heavy bleeding? So we need to tell the girls about all these things, that they need to access health, keep the reproductive tract healthy. Next. Next, Kavita. So we also have infections, STIs, whether it is sexual, these are all sexually transmitted, and it could be even without sexual transmission. Parasitic infections, they need to be treated. Fungal infections, viral infections, tuberculosis, and anaerobic infections, bacterial infections, all this can lead to infertility and other problems. So we need to treat them, chlamydia, gonorrhea, etc. So this can be easily treated. Next. So acute pelvic infections and PIDs, they may even can happen following delivery and abortions, any gynecological procedures. So we have to look for it and treat them, even including tuberculosis infections. We can identify by the vaginal discharge, and we have ways to identify them and treat them. Actually, simple treating is that we have a lot of STI clinics established by the government now, Suraksha clinics. So people do not know. The adolescents do not know they can access for treatment of sexually transmitted infections. For adolescents, we do not make them lie down or test them. So it's only symptomatic. So if just the symptoms are there, what all they say, itching, ye ho raha, then there's a treatment given. Like kits are there, kit 1, 2, 3, 4, like that. So whenever just by symptomatic management is happening for STIs now, so that it is more adolescent friendly. PCOS, again, a problem before they want to conceive. So this can come in the way. Polycystic ovarian syndrome is associated with infertility. So we have to identify and treat them whenever there's a evidence of hyperandrogenism, abnormal uterine bleeding, irregular cycles. We have to diagnose PCOS and then treat them. So we can treat them by hormonal, estrogen progesterone combinations, and even lifestyle modification, insulin resistance, to deal with that. And metformin can be advocated with behavior modification. So once we take care of their lifestyle, they may start, they may they are likely to conceive. So we have to actually counsel them and tell them about, the management of PCOS. Next. So preconception counseling for men. Not is all the time we talk about only women and girls. So it's very important that men are not left behind. It's very important that men also are brought, and they should, in fact, we should encourage the men to come for counseling. They should, I hope I can see in the future sometime when men are coming saying that I want to have a baby, and both of them are coming for counseling together or even alone. It is actually very progressive change. We have to see that in our community. So it's very important that they have healthy sperms. It is important for fertility and well-being of the future offspring. It is important for men to be aware that the factors can affect. There are many factors which can affect positively and negatively. The quality of the sperm can be affected. So this is very important for the men to take primary care before they have children. Next. So this is the normal sperm analysis report, and this is the sperm count in every ejaculate. What is the volume, concentration, what is the motility, and morphology. So when there's should be known for all the boys. So the effect of alcohol on sperm quality also, how it hampers, this is also should be shown to the boys. Next. So factors negatively affecting the health of the sperm is one is age. 20 to 45 years is the most fertile period. So like we said, 20 to 35 years is the most optimum age for pregnancy. For the men, it is 20 to 45, most fertile period. And health status of the individual is very, very important. Like for the woman, for the boys also, it is important they take care whether they're having diabetes mellitus, hypertension, hypothyroidism, and also STIs, so that they get treated before they want to conceive. And they should also know, we have to also count the medications what they're taking. Antihypertensives, anti-epileptics, anti-cancer drugs can affect the quality of the sperm. Environmental toxins, pesticides, lead, mercury are known to reduce the quality of the sperm. Lifestyle is also important. Mental health, like for the girls, for the boys also important. One important fact they should know, masturbation does not affect the quality of the sperm. Next. This is another new thing, somehow we have to really propagate this. Gadgets and phones have been part of our life for over last decade. So this is really causing havoc to the sperm quality. Spermatozoans are exposed to the radiations emitted by the mobile phones, and the sperms have reduced motility, structural abnormalities can happen, increased oxidative stress associated with duration of the mobile phone. Every time the mobile phone is in their pockets, and all the time it is on. So this is very, this maybe is not being told to them. I mean, we have to really highlight this fact. Radiations, pollutions, chemicals, pesticides, and smoking, drinking, STIs, sexual violence, all this can affect the conception. Cause of infertility, the male factors are there along with the female factors. So 1/3 are male factors, 1/3 female, another 1/3 could be a combination. So on the right side, you can see the cause of low sperm count, stress, anxiety, and all what I mentioned. All this can lead to actually low sperm count. Next. So coming to sexuality, what is sexuality? So we all know it's a comprehensive thing. It's not just sex. It's about the emotions, how to deal with the opposite sex, and how you can be confident about taking your own decisions, all come under it. And we have to also tell them, for the boys and girls, there's no hurry to consummate. Let them first relax, bond with each other. Interpersonal relationship is very, very important before they conceive and plan a conception. So we need to tell them, don't get affected by the media. I mean, you have take your own time. Be bold to discuss about between both of you. Hardly in our Indian marriages now, at least we are seeing some marriages which are there planning their own, selecting their own partners. But earlier it was all arranged marriages. So they were all strangers, and then suddenly they are together in one room after marriage, and then they hardly talk to each other, but they have they go proceed without even taking safety precautions or planning when they want to conceive. So this is something very, I think it's ironical. We say कि इतना distance रखते हैं और एकदम से suddenly they are so intimate, and then they don't have any openness or boldness to even talk. Whether they may have HIV, they may have STIs, but they cannot even openly ask, feeling they are afraid of even expressing themselves. So respect is important. Caring is also very important before they conceive. So first, developing a good interpersonal bond is a very basic thing before they create a baby. Next. So, realizing that, there can be a depression also, post-nuptial is all about, not about positive things. So they can be let down after all the excitement, and, they sometimes they don't even talk about the things which are very, very important. So we need to, identify all these mental health issues also. Next. Signs of a marriage in danger. So when there's constant criticism, lack of intimacy, financial issues, infidelity, or abuse of any kind can also hamper the interpersonal relationship. Next. So it's very, very important to have a good support system. So the support system in the way of a good family, maybe the joint families nowadays, we do not see many of them, but at least see that your identity is very strong. You are able to talk to each other. You should have all the life skills to say no when you are no, do not want to have a baby. You should be able to negotiate and talk, and then take care before you conceive, that you treat yourself from all the infections, be it you metabolic, have good financial soundness. Financial support system is very, very important. Plan, because when you have a baby, you need to have resources. So that's very, very important. And optimal timing, whenever you're ready mentally, physically, then only they should conceive. So right knowledge about all the topics which we have mentioned are extremely important. And the government is also doing, but it has to do more on the preconception care. We as IAP and AHA can also do a lot. And we have to, at the right time, tell them, and target the right people. And we should be told the way they want to listen. So it should be acceptable, so that we have a good positive, outcome when we take this preconception care in the society. Next. So I end with this 10 commandments. I think there are a few commandments here. So one important point is to tell them about the correct age for becoming pregnant, 20 to 35 years. Please avoid teenage pregnancies. And always best to have a planned pregnancy with good spacing of 2 years before conceiving. So you have to use contraception. Pre-pregnancy checkup is very, very important. Screening for hypertension, diabetes, PCOS, thyroid dysfunction. So become you metabolic before you conceive. Please take supplements, take care of your nutrition. Folic acid is extremely essential. Take all the vaccines which are recommended. Maintain an ideal body weight and healthy lifestyle. Correct anemia. Screen for all STDs, infections, including HIV, AIDS. Genetic disorders have to be screened, because that's the only way you can prevent the occurrence in the next offspring. Screen for mental well-being. Seek help if you have any problem. Avoid all substance abuse, use like alcohol, tobacco, narcotic drugs, and avoid self-medication. Pollutants, take care of the pollutant, environmental toxins and radiation. Have a good interpersonal relationship, that is the base, and good life skills and a good support system, extremely essential. And please, we need to encourage them to feel free to talk to your doctor. Tell them about the all bad obstetric histories they have, or any other medical illness, abortion, fetal loss, etc. So this have to be spoken to the doctor before they have counseling. Next. During the counseling also we can ask these questions. So we have to remember, under the base of genetics, which is only 20%, the 80% is epigenetics, which we all can modify. So at one end we have proper nutrition, which is extremely important, stimulation, healthy lifestyle, very important for a happy and healthy child. Next. For the first 1,000 days, which is a very compelling investment now, the government is, we all understand that if you invest on the first 1,000 days, they are 10 times more likely that the life-threatening child diseases can be controlled, and the child will have, this is all established facts, competing 4.6 more grade at school, that is more QI, and go to the earning capacity also increases when they become adults, and they're more likely to have healthier families and when they become healthy adults. So it is important to invest on the 1,000 days. So before investing on 1,000 days, I am propagating that please go behind, 4 months behind, have a good preconception care before you come to this 1,000 days. Next. So the key message, I would leave with this one strong message, that preconception care is a very less talked about topic, but is a very much needed topic. And all of us should come together, the IAP, NNF, Adolescent Health Academy. This is the right platform to take this message to the young adults and children. Let's lead the campaign, start and lead the campaign for preconception care. Thank you. Thank you. That's the best start of life. Thank you.
Thank you, ma'am. Excellent talk. Excellent talk. You described everything, and the importance of the pre-conception care is important, from nutrition, vaccination, and the other metabolic genetic disorders and everything. Definitely, it will help the pediatrician to counsel their coming generations for to help them for making good foundation for both for the couples for and preparing them for the marriages. Thank
Thank
you.
you, sir. MKC sir, thank you for being there. Thank you so much.
Thanks a lot,
Shilpa.
ma'am. Thank you, sir, and thanks, ma'am, for such a engrossing talk. And moving ahead, I would like to invite Dr. Namita Srivastava, ma'am, our next chairperson for the talk, to share her remarks and to introduce our next speaker, Dr. Preeti Galagali, ma'am.
All, I would like to thank you, Dr. Himabindu, ma'am, for such a elegant and such a nice talk, wonderful talk, ma'am, because it is a very underrated topic, but
Yes.
very important one. Because as you said, right start is the basic need.
No, actually, my daughter, who was listening when I was doing the sessions all over the country, so she was telling me she's also a young adult. She's 25, 26. She says, we didn't know all this, Ma, and you're telling to the whole world, I want to know. So that's a curiosity, and I thought it was very, very important, and it's very much needed to all the young adults. We need to talk about this, and we can do it.
Yes.
And we should have
Yes.
special clinics also. I hope that could be established in future.
Yes.
Thank you.
So for our next talk, I would like to invite Dr. Preeti Galagali, ma'am. She's a star and versatile speaker, and I don't think so words are sufficient to introduce her. I simply invite her for her next talk. Preeti Galagali, ma'am.
Yeah, thank you so much, Dr. Namita. And once again, it's a pleasure to be here this evening. And I would just kind of carry on from where Dr. Himabindu left. And I would say the first 10,000 days of life are the most important. That is covering from 0 to 24 years, because that is really going to lay the foundation of preconception care. So I think we should be all rooting for the first 10,000 days rather than just focusing on the first 1,000 days. Having said that, I must at the outset thank Samvad Nimhans for sharing their slides with me. They were scheduled to take this talk, and actually originally Dr. Shushma Desai was, but she could not due to some reason. And then I had requested Samvad Nimhans, but they shared their slides with me, and I'm very, very thankful to them. So most of what I am talking today is from the slides, and we are going to be talking about life skill education in therapeutic contexts. We often, talk about life skill education in schools, but can we really use this for therapy in individual and group sessions? And this is just an introduction, because there is so much more to do and to learn. So the objectives of my presentation today are to understand the basics of life skill education, especially in the context of children in difficult circumstances, to introduce a life skill framework for socio-emotional regulation, and to make informed decisions about sex and sexuality related behavior, and to outline components of designing a life skill education program. So let's go deep into first the basics of life skill education. Now, the concept of life skill education historically started in the 80s and the 90s when WHO started talking about prevention of HIV infection, which was found so much in the youth. And in that context, for making informed decision regarding the use of condoms, healthy interpersonal relationship, and to stem the tide, this came into being. And since then, there have been different concepts of life skills, and let me share a few of them before going into the WHO life skill framework. So, life skills, as we are so fond of mnemonics in adolescent medicine, could stand for social skills, letting go and holding on, living in balance, intimacy, kindness, so very important in the current world, solving problems, emotional development, fitness and health, because there is no mental fitness without physical fitness, and they go hand in hand. We are well aware of the mind-body connect. Identity and self-awareness and learning, lifelong learning. There's another concept of life skills which talks about listening skills, communication, handling disappointment, negotiation, creative thinking, problem solving, and leadership. Now, the WHO gives these definitions, and it says life skills are adaptive and promote behavior, that positive behavior that enable individuals to deal with life effectively and face the demands and challenges of everyday life. So pay focus, it is adaptive and positive. So these are very key words when it comes to life skills. And what are these life skills? So these life skills are those which help people to function well in their routine life, also help those who are in distress, and they are a must for everybody. So how do we all remember this list of life skills? I would refer you to the Thirsty Crow story. And you all are familiar with the Thirsty Crow story. I don't have to say it aloud to all of you. Now, if you carefully just think about this story, what was the first life skill that this thirsty crow used? Self-awareness. Yes, he was thirsty. And if he didn't get water, he would die. And yes, he was very precious to his parents, to the community. And that's why he had high self-esteem and confidence in himself that he could solve his problems. He took a deep breath. He coped with his stress. He did not give up because of sadness. And then he used his creative thinking, used multiple options. He tapped the ground, he tapped the pot, he did not get any water. He analyzed the pros and cons and then made the right decision to throw the stones into the pot, and the water came up, and he solved his problem very, very successfully. So the life skills are self-awareness, self-esteem, coping with stress and coping with emotions, creative and critical thinking, problem solving and decision making. And just for some time, imagine that he had another flock of crows just close by and who were also thirsty. So what would he do? With a lot of empathy, understanding the distress of his fellow crows, he would then use effective communication and interpersonal skills to help them also quench their thirsts. So, ladies and gentlemen, you have all the 10 life skills here, and these are divided into social skills, thinking or cognitive skills, and emotional skills. Time does not permit me to go too much into the methodology of imparting life skill education, but I hope that I would be able to really motivate you to read more about the methodologies. Now, we all know these are life skills. And are they just a bunch of skills, or do they play different roles in various contexts? Now we are talking of children in difficult circumstances. These could belong to single-parent families, face rejection and abandonment, parental-marital conflict, loss and grief, especially in the context of COVID. We know how children were devastated. Alcohol dependency in parents with mental illness or disability, physical, sexual, and emotional abuse, street children, child labor, working children, school dropout, those with learning problems, conflict with law, in living in disaster zones, in war zones, and with illness and disability. So you would understand that life skills have special relevance, especially to help children in difficult circumstances. So to better understand life skills for whom, where, in what type of situations or experiences, and addressing which problems and vulnerabilities. So we talked about certain circumstances. Now we talk about personal context. Who are these children in difficult circumstances? Those with a learning disability or those with other disabilities, school-related vulnerabilities. It could be learning issues, dropout, abuse, or bullying, orphan and abandoned children, street and working children, HIV-infected children, children affected by gender and sexuality vulnerabilities, children in conflict with laws, and children affected by disasters. So we have a personal context and we have a situational context. In both of these contexts, life skills are really important. And what if they don't have the correct life skills? What does this lead to? It can lead to an internalizing disorder like anxiety, adjustment disorder, dysphoria, depression, post-traumatic stress disorder, including dissociative disorders and even bedwetting. It could lead to externalizing disorders like runaway behavior, self-harm, anger, aggression, substance abuse, and life skill deficits, sex and sexuality issues, and perpetrators of bullying. So we can implement life skill interventions to address these concerns through a framework. And what is this framework? We use the lens of life skills, as we said, for therapeutic interventions. So we have a context, as I said. This could be a personal context or a situational context, both in fact. What are the life skill deficits and what experiential methods of learning? Remember, life skills are always experiential and participatory. These are the interventions that we use. Now I take you back to the case that we discussed, and I posted it on the group as well. Remember, we had this case coming to us with a self-harm behavior because one of the peers forced this adolescent to cut the forearm. You remember that, I hope. So what is the context in this case? So there was probably a learning disability, there was low self-esteem, and the context was also bullying by peers and physical and emotional abuse by parents and teachers. So now we understand the individual context and we understand the situational context. And what do you think were the life skill deficits? Now it's easy for you to understand the deficits were in self-esteem. Yes, definitely. The child was feeling very low, if you remember, lonely, feeling left out, self-awareness. Yes, I'm good in yoga, but I'm terrible in studies, and that's why I am no good. He had difficulty in coping with stress, coping with really high levels of sadness because he had nobody to talk to in the school. And he was also feeling sad because he was feeling upset with the recurrent abuse of the parents and teachers. He was unable to overcome his academic stress. There was deficit in creative thinking, also critical thinking, and hence there was poor problem solving and decision making because he fell prey to negative peer pressure. Obviously, there was lack of assertive communication, and probably he did not have good enough interpersonal life skills with his parents to ask for help because he was so much upset with them abusing him. So now that you understand where are the life skill deficits, what are the contexts of application, now it would be easy to actually impart counseling. And what are the experiential methods of learning for this particular case? If you remember, this child loved yoga. So yoga, pranayama, exercise, music, prayer. Remember, he was going to Lord Krishna and asking help. So all these are the methods which will help him to relax. And if you remember what we prepared, a safety planning intervention, it had all these techniques. Here, in the clinical context, in the clinic, we did role plays, how to manage peer pressure. We also told stories where children and adults who have done well even after learning disability. And you know some famous examples like Thomas Alva Edison, Albert Einstein, and all. Also narratives. How did he feel about a particular situation and how could he have dealt with it differently to keep himself safe and not to spoil his interpersonal relationships? Always remember that these skills are done in partnership with parents, teachers and peers, because even parents had life skill deficits here of communication and interpersonal skills. Even teachers had similar life skills deficits, and even peers had. So we would have to do a collaborative management in this case, and it was really done for a very successful outcome, because this child is now actually owning a gymnasium and he's doing really well in life. So this is what we did in the clinic without referring to a mental health professional, because the child and the parents simply refused to go there. And life skill based counseling was in fact very, very effective in this particular case. So here we have talked about the curative purpose of life skills, but we are very familiar with the health preventive, health promotive aspect, and we say definitely it is for all children. But I want to emphasize and re-emphasize life skills are more so important for vulnerable children and those at risk, those with mental disorders, including developmental disabilities, like in this case. So when you see for curative purposes, you can see for an internalizing disorder, coping with stress, coping with emotions is important, and so is decision-making, communication, and problem-solving, as was the case in this particular case. For externalizing disorders, ADHD and conduct disorder, the child here gets violent and very, very aggressive. So critical thinking, what is the effect of my behavior on others? Should I have empathy or not? How do I develop empathy? How do I deal with intense anger? How do I build up healthy interpersonal relationships is important. And so are problem solving and decision making. So once you understand the context and the life skill deficits, you can easily plan your interventions depending on what the child likes. For the child with learning disability, I would not recommend journal writing, because the child really doesn't feel like writing and he hates writing, in fact. So you can make your interventions very, very individualized. So how do we do this? We don't give a lecture, right? When we talk to the child, even in our clinic, we use conversations, we use discussions, encouraging opinions, debate, and perspective taking. We do not provide value-based judgments. We always stick to the science, discussing pros and cons and helping them to really make a very healthy choice in life. When I talk about values, what I mean is we respect an individual's value, we respect the family value, but we don't put our values on that particular adolescent. For example, I believe that getting up in the morning is the best time to study. Right? That is what we do in my family. But the adolescent may feel that nighttime is the best time to study. As long as he's having his 8 to 9 hours of sleep, it is okay to really study at night. So that is what I mean. I just give you a very, very simple example. So remember, life skills actually empowers the individual over the whole lifespan. It is not just for just adolescents. In this, we believe that all participants are learners, including me, including the facilitator is a learner, and the learners are the subject and not the object of the program. All participate and contribute equally to productive knowledge, which is a continuous dialogue. So the content, like I said, depends on the context and needs of the group. So you can even have a group of children who are probably abused, a group of children in a childcare institution, a group of street children. So you can have a group like that. You can decide the methodology for different sessions. Do you want to use slogan, movie, theater, role play, games? But please remember, it's very, very important to involve children in all the exercises which you use to impart life skills. Be open, be flexible, respectful, non-judgmental, and really always follow active listening, as we have always been emphasizing and re-emphasizing in all these situations. Now, I'm going to show you a video clip. And I want you to answer these 3 questions at the end. You can note them down if you wish. What's happening here? What are the feelings of the people involved? how else could the situation be resolved? So the first question is, what's happening? What are the feelings? And could something else be done to resolve the situation? Here we go. I hope you all can see the video. Is the video visible?
Yes, it's visible, ma'am. मैम वीडियो का साउंड नहीं आ रहा है.
You can't hear?
No, ma'am.
Actually, it's paused right now.
You can't hear it?
No, ma'am.
No, ma'am.
Don't know why I tried this before.
हाँ, तब तो सुनाई दे रहा था.
हाँ.
While sharing, you will have to tick that audio option on.
Oh, okay. Should I?
Yeah,
should
you
I?
stop share and then again you click the sharing tab.
Okay.
And then there will be a button for audio option that you have to click on.
Where is the audio share sound? Okay, yeah, I
Yeah.
got it. Yes. Yeah. Got it. Yeah, so sorry for this.
वही है बंदा जिसने मेरी पिटाई की थी, आज उसकी धुनाई करनी है. आजा मेरे साथ तू.
अरे यार नहीं यार, वो हमारा इलाका के लौंडा है ना, उसके साथ पिटाई क्यों करना है? वो पिटाई के बाद कुछ प्रॉब्लम हो जाएगा तो वो अच्छा रिलेशन भी है उसका एरिया कॉर्पोरेटर के साथ, उसके पास क्यों हम पिटाई करें?
यार मैंने तेरी मदद की थी जब तू तकलीफ में था, और तू आज ये कह रहा है कि वो उसकी तरफदारी करे. कैसा दोस्त है यार तू? हाँ, कैसा दोस्त है?
ठीक है, अगर तू बोल रहा है तो चल.
आज तो इसकी ऐसी पिटाई करनी है ना.
नहीं यार, मैं इसलिए आया हूँ क्योंकि तू मेरा दोस्त है और फिर तू मेरा मदद
सिखाना है इसको. देख रहे कैसे घूर के देख रहा है.
हाँ, घूर रहा है तो अभी देखना यार, तू मेरा दोस्त है इसीलिए मैं तुझे बता रहा हूँ ये सभी, कि तूने बुलाया मैं आया, पर फिर भी तुझको ये जानना है ना कि वो पिटाई करेंगे उसका तो पुलिस के लेफ्ट है, उसके बाद कॉलेज से रेस्टिकेशन हो जाएंगे और फिर उसके बाद और एजुकेशन खराब हो जाएगा. देखना यार, एक काम करते हैं, अगर अगली बार ये करता है ना तो प्रिंसिपल को हम ही जाकर कंप्लेंट करेंगे.
So what did you feel? Would anybody like to unmute and tell me what was happening here? So do you all agree this was a case of peer influence?
Yes, peer influence.
Yes. Yeah. So what do you feel? Was it a negative peer influence or a positive peer influence or a neutral peer influence?
Positive, negative turned into positive.
Fantastic. So these are the kind of questions that you can ask after showing just this 1 minute snippet, So this can really start a conversation for the students to start with. Oh, let me just change the next slide. Let me just take this. Yeah. So this was a very small way of, I'm showing you the methodology through films. Now look at this. So you remember this adolescent who felt, I'm no good in studies, right? I'm no good in studies. And this was such a big problem. You tell the adolescent to draw a figure and say, what are your roles and responsibilities? I'm a son. I want to do a lot for my parents. If you remember, that was what this adolescent wanted. My qualities and talents are very caring for my parents. And also I want to become an Ayurvedic doctor like my father. And I want to do yoga. Yes. And what are the fears and worries? I'm no good because I'm not doing well in studies and I'm also not having friends. So fears and worries are a very small part of your personality. They're right there on your feet, but the rest of the body is so much more. So your identity is not defined by your fears and worries. It is more than that. So this is a great activity for self-esteem and also self-awareness. So all this and more is available in this module, which I'll be sharing with you. And this module is available online. It talks about exactly the activities to be done for developing self-esteem, how to handle difficult and traumatic experiences, coping with fears, worries, peer relationships, anger management, empathy, bullying, assertiveness, conduct disorder, substance use, and leadership. So I'll be sharing the link. So this will tell you the exact methodology. Now coming to sexuality, this is really important because it sets the foundation of the next session on trauma-focused care. And you will listen to Dr. Shekhar Sheshadri referring to this window approach of sexuality decision-making. So what the Nimhan Samvad team says is step one or window one is acknowledgement of emotions. We know the need for love and care is for everybody. And this age group, the need is intense. We need to be accepted. Now, privacy. The privacy is windows have curtains. When we take a bath, we close the door. So there are some parts of a body and some of the activities that we do are in private. Consent. Suppose this is my favorite pen. Would I give it to anybody who walks in and asks for the pen? I will not give that because I will give to my favorite pen to only that person whom I trust, whom I know for a long period of time. And will I like it if the parent comes, the particular friend comes and snatches away my pen and even hits me? So what he has done is he has actually crossed the boundaries. If I can do that for my pen, what about my body parts? Can somebody touch my body parts without consent? What are the basics of healthy relationship? Mutual trust, mutual respect, the ability to actually respect no. So these are some of the windows which we talk about healthy relationships. And if I fully trust that person and I want to go ahead with sexual intimacy, do I know what are the consequences of being sexually intimate? Do I know about contraception? Do I know that I can get pregnant? What can be the consequences? Do I know that I can get HIV? So that is called health and safety. And finally, I should know about the laws of the country. So all these windows are so very important when it comes to sexual decision making. The basic aim is to form happy, safe, healthy, and responsible relationships in life, whether sexual or platonic. So all this and more is again given in this module. This is a fantastic module which talks about gender, the real man, the perfect girl, attraction, love, health and disease, safety, abuse, the POXO Act, relationship roles. So again, I'll be sharing this with you. So this gives the methodology. So when we design a life skill program, as I said before, we should select the group. We should set the group norms. We should plan the structure of the session. We should plan each session in detail. How are we going to implement it? And we should have documentation. All this has to be done prior in advance, especially in a group setting. So when I talk to you about these manuals, though these manuals are for a group setting, but let me tell you, they are very, very effective even in an individual setting in the clinic. So setting the group norms very, very quickly, respecting each other when we are sitting in a group, listening to each other, not passing comments, helping each other, building up trust and confidentiality. Whatever is shared in the group is not shared outside. The sitting arrangement. So I should have movable chairs. If I want to do some role plays or I want to do discussions, the chairs should not be fixed. Structure of the session, a recap if I've already been doing before, or an introduction with an icebreaker. What can be the icebreaker? We can do some jumping jacks. We can play some games together, right? What is the main activity? And the conclusion. What new did we learn today? What is one thing that you take from this session? And information about what will be done in the next session. Whenever it is noticed that children are losing focus or losing the touch with you, please do some energizer. So I often tell them, raise your hands and then pat yourself on the back, and they love it. You know, give yourself a positive stroke. So the session documentation after the session is extremely important. Which was the target group? What was the objective of the session? What was the activity? What and how you did the methods? How the activity was processed and discussed? How were the children's responses? What were the powerful moments in the session? What methods work? And more important, what did not work? What were the limitations faced? For example, today the limitation was that I had not put on the audio, right? And so my video did not work. So now from next time onwards, I would be more cautious. Thank you so much, Dr. Agarwal, for helping me in that. Okay, so is life skill-based education has a lot of research? Yes, it has, and more research is coming in the past few years. So I recommend these two papers. Of course, as always, I will be sharing the PPT with you. So please have a look about the difficulties faced in doing life skill education, especially in group settings, and how effective they are. So, you know, adolescents are impulsive. You know their prefrontal cortex is still under development, but you also know that the more we stimulate them, the myelination, the connect of healthy neurons become stronger and stronger. The neurons of healthy lifestyle become stronger and stronger. So what do lifestyles do? They help them to hit the pause button, which is so very important, which adolescents find difficult to do in really real life. So this is a fantastic quote, which I simply love, by Viktor Frankl. Between stimulus and response, there is a space. In that space is our power to choose our response. In our response lies our growth and our freedom. So be responsive and not reactive. Life skills, we can take them wherever we go in life, no matter what we do. And this is a picture long ago, I would say around 20 years ago, from my clinic. And you see the young people here after a life skills session. They are now doctors, engineers, entrepreneurs, scientists, police officers, IAS officers. So you can see how life skill education actually goes a long way. So very rightly so, the theme of the International Adolescent Health Week and the IAP Child and Adolescent Health Week is about resilience. And resilience is bouncing back from failures. And we have lots and lots of examples. I can just think Prime Minister Modi is one glaring example. Out of all the childhood adversities, the way he bounced back. We know that. We know in the recently concluded Olympics and Paralympics, the media is full of such resilient stories. So please go ahead and share with them share with all the adolescents, young adults, these stories. Use life skills, use the modules, and in the end, make an adolescent very capable of realizing his potential. Thank you so much for a very patient hearing.
Thank you, ma'am. Extremely wonderful.
My goodness, this phone is the best of the lot. Look,
yes,
Amita?
another fantastic session. Very nicely you covered everything. Congratulations. Any question?
Oh, yes, they are worth lots of money.
Sir, there are questions in the chat box. You can take them.
Anytime you like to see them.
Is somebody
Madam,
going to read
how
this?
resilience is different from life skills? How resilience is different from life skills?
Yeah, that's a great question. That's a great question. So resilience is in the context of adversity, right? So it's bouncing. So you think of a bouncing ball. When you put it down, it bounces back and it bounces even higher. So in an adversity, we don't go down. We do even better than before. Life skills, there need not be adversity. So for example, somebody is asking me to smoke, or you saw this instance, right? Where what was happening here? This boy was asking to, bash up the other boy. There's no adversity here per se, right? But still, the healthy choices are made using life skills in a context, even when there is no adversity. If I want to choose whether I should eat a fruit or a cake, I might use life skills, right? So those will be the life skills that I will use of critical thinking, analyzing, and make you choosing the right kind of decision. But you must see that life skills are a very important part of resilience building. And I think in resilience building, what is very important is self-esteem, self-confidence, which is in fact called the mother of all the life skills. Right? So there is a faint difference, but life skills can be used in all contexts, adversity or no adversity.
Okay, thank you. Madam, one question is for Dr. Himabindu.
Yeah.
What is the meaning of incidence of preeclampsia is 33%? Somewhere you
What's
said
that?
that chances of preeclampsia is 33%. Dr. Himabindu, ma'am?
Yeah, I think I mentioned it for when there's a delayed age of pregnancy, there could be a high incidence of preeclampsia. So I just mentioned those statistics. So we just, I think we're talking about optimum age of pregnancy because we don't want underage or over delayed pregnancies. So we mentioned about the complications, and preeclampsia is one of the complications.
Can metformin be given at the time of trying to conceive?
No, I said that metformin is part of the PCO management, not for all couples. It is only when you are having a diagnosed PCOS as a lifestyle modification. So the metformin is used when there's an indication.
How do we check for healthy sperm? That you have given that chart that you discussed it.
Yeah.
And
I think Dr. Kavita wanted me to speak more of interpersonal with Dr. M.K. Sinha. I already mentioned, sir, has mentioned about the interrelationship issues. So though I just mentioned about it, I thought we'll have to cover the other aspects of nutrition, the vaccinations, preparing for you being metabolic, and screening for genetic disorders and other problems before they are planning for pregnancy. Interpersonal relationships are extremely essential. That is the base actually. So while we screen from all other disorders, it is important that both the boy and the girl, or the wife and the husband, have to be have to have a very strong interpersonal bonding, so that they are prepared for creating and nurturing the child. So that's very important. Respecting intimacy and being sound, financially and mentally prepared. And of course, when these times when they are nuclear families and both are professional and having their own professional careers, it's very important they time the babies. So we need not compare our lives with anybody else. So each one have to understand that each journey is different. Each one's journey is different. So we have to prioritize कि अभी मुझे क्या करना है. So if you want to give time for your post graduation, it happens in our medical students also. So it's okay. We all have to be supportive. So it's their individual choice. And they need to be prepared first mentally, psychologically, physically, in all ways before they create. That's what we want to say. And of course, having a baby, I think we should also say that don't leave those babies once you give birth. They usually they give it off to somebody, to the elders or somebody in the family to take care, and they move forward for studies, which I feel it is really pathetic for the baby. We should prioritize. It's okay to be a little bit, our professional career may be a little bit delayed, but it is a 20-year project. It is a right of the child. We need to really take care, especially the first 2 to 3 years is so critical. The government is giving a lot of leaves, the child care leave and maternity leave, paternity leave. It's all for nurturing the baby. So we need to utilize all this and understand the importance of being there for the baby, especially in the first 2 to 3 years of life. So I think it's all about individual prioritization and being mentally and physically prepared to create and care. That is so important.
Prioritizing for the baby is more important than the career and the other things.
Yeah, so it's so they need to give time. So they have to plan when they want to give that break and then give time for the baby.
Sir, can I just intervene a bit, sir? A little bit?
Yes.
I mean, I respect what you said, Bindu, very much. But in this current era, I think we as people who are counseling, we should not be deciding for the couple. We can just say, yeah, please excuse me.
I'm not saying that what Dr.
The pros and cons,
I didn't
allow
want to
the couple to. So if the mother is feeling depressed for leaving her post graduation, that's not a very good thing for the mother. And if she has the support of the grandmother to look after as a caretaker, I think it's good if it suits the family. So as counselors, as we always saying again and again, it is not what we feel about the thing, but what the couple wants. We definitely need to tell them the pros and cons, but I think in this era, we will be very much biased against mothers if we kind of tell them, why not the father leave his post-graduation? Is my question. So, I
No,
mean, I don't
we are
want
not,
to get into
so Dr.
I don't
Preeti,
want to get
I didn't
into
want to
this
contradict
gender
Dr.
war,
Sawan.
but I would say that let's retain our balance. I mean, I would say analyze the pros and cons and allow the family to take what is the best decision. I have many fathers who take a break from work, taking the baby for breastfeeding. I have that, and that's true story from my clinic. And the couple is doing very well. So why not? If the father can take the mothering role, why not? Is my question. So I'm sorry, beg to differ with you, Bindu, on
No,
this.
no. I never said that if a woman has to take a break. I just said the couple has to decide together. It's their individual decision, and we all have to support in all ways possible for them and respect their decision. So it is their own decision, and they have to take prioritize whether when they want to have, whether it is this or that. It is their individual decision. We need to be supportive. We are gender neutral and promote whoever is doing it, and we have never said that it is only the woman who has to do everything. Yeah, I
Thank
think.
you. Thank you, Bindu. Thank you. Thank
Ma'am, that is why we are doing premarital counseling, making them
it is
strong
important
bonding
that
between them and
they both have to
understanding
be
them.
involved. In fact, this module we have highlighted the role of the men. It's so important that the men's sexuality and men's reproductive health and men's support, all that we have highlighted in this these sessions. So it is important that we have both have to come for counseling and encourage the involvement of the males into this whole process of conception, nurturing. All this is a family. It is after all both. It's important for both to be there. So we have to respect that.
Yeah, absolutely. I think we also need to make some decisions like who's going to change the nappies? Who's going to stay awake in the night? Who is going to take a break? How are we going to manage both of us with our careers? I think these are some things before having a baby, before even thinking of having a baby, which have to be kind of worked out between the couple, because this, according to my experience in the clinic, this is actually causing breakdown of marriages very, very early. And it's unfortunate. It's really unfortunate because these decisions have never been discussed. We can talk about a lot about physical health, mental health, but what about, like somebody already asked, interpersonal? I think that's really, really important. Are we on the same page? And I would ask MPSC sir to help us further. I know he has some objective assessment also, so we would ask him to help us with this.
I think somebody asked the question, what is the difference between life skill education resilience?
Yeah.
If you have good life skill for quite some time, then that becomes the beginning of resilience. Here, exactly same thing. To solve your problem, who is right? You or Himabindu, both actually were saying almost the same thing from two different angles you are putting it. But the point is, life skill is a capacity to do something without creating problem for the other person. Okay? If the couple can do that, whether it's a man doing it or a woman doing, having said that, there are few things only the woman can do, that we cannot deny the biological part, yet he can be very helpful. Now, if you do like that, then the resilience will come for the couple. You know, at the end of the day, they are quite capable of managing their issues without hurting each other, without stepping on each other's foot, and without spoiling their career. Because the career, as you said, you said it from 2 points. One, the opportunity for a post-graduation won't come every day. You can't just leave it like that, because then you may never get it. That's 1 point. On the other side, also you emphasize that it's not your business, say, who should do it and who is right, mother should do it. Such things we cannot push on the mother or the father, but you can say the pros and cons and let them decide. But having said that, Indian couples never decide. Get that also be clear. So at the end of the day, it has to be a little slow process, you know, where they will be able to. In the end, after listening to you, they'll say, sir, but sir, if you are in my position, what will you do? That is the question they will always ask. So anticipate that and keep on saying that if I were in your place, this also I would have done. So you say it in advance so that don't let them ask the question. Excellent session.
Thank you, sir. Thank you. We'll learn.
Both excellent sessions. Yeah. I think Himabindu, one thing you forgot to highlight is that folic acid. We have said it before, but I think you need to really highlight that neural tube develop like from a neural plate, fold by itself. By
Yes.
24 weeks, it becomes like this, and a hole may be there. And because of you get pregnant between two menstrual cycle, 14th, around 14th day. So 14 plus 7 days you wait for the pregnancy suspicion. That means 21 plus by the time you reach gynecologist, it will be another 3 days. So before 24 days, no girl ever reach a gynecologist.
Yes,
So
I did
whatever,
mention, sir.
whatever.
I did mention, sir, that we are missing the critical time. So
Yeah,
before
but
they come to
that's not
us,
enough. Missing is
yeah.
not enough because
Yeah, we have
the
to.
audience may not understand why exactly you are pushing it so much. So I think you need to give little more. It is there in the module. I
Yes,
understand.
sir. No, it is module. We have a 3 hours, Dr. Kavita.
That's it.
In the
I know.
module, we have this. Each topic is half
Okay.
an hour. And I
Okay.
condensed it because you gave me half an hour time.
Yeah, I know. But this point is very, very important.
But that was excellent, ma'am. Whatever you included was really excellent. Just wanted to say that premarital counseling should include everything. So that might be in the module. Because most important is the maintenance of the relationships. Besides baby management and sexuality, the relationship, the family bonding is very much important. The basics behind the breakup of the family is that they are not prepared for the responsibilities they get all of a sudden after the marriage.
Yes.
So marriage means just a flowery they see in the movies, and then only materialistic things and all those things. That chain has to be broken up.
Yeah,
Now the
actually,
families are breaking very much because of all these things.
No, normally when we talk to these young adults, we also accept that it's normal to have attractions, and then what happens, they also may have to have, they want to experiment, explore their sexuality, and then we have to definitely talk about safe sexual behavior, and in case they get pregnant, give them options of contraception and all those things. But we also need to tell, having a baby, biologically, maybe you can conceive when the sperm and the ovum meet, but then are you ready? Are you ready to create a baby 9 months, and then later what it means to them? So we have to tell that seriousness. Having a baby is like how you are born, what your parents are doing. So you need to be with them, nurture them, take care of them. So are you so ready for it? So interpersonal relationship is very important. As you are already saying, we do all that, and it takes a lot of time, and we have to definitely talk about whether they are mentally, physically prepared to create and conceive.
One other important thing, again, last time we said it, but need to be repeated. Loving is not so much important as caring.
Caring, yes.
A person caring is what you need in life.
Yes.
Love anybody can do. And another point is you have reality and fantasy. Fantasy is that energy that make you move on. But reality is a stability that your marriage goes on. Now, as I always say, you don't try to change your father. You don't try to change your mother. You don't try to change your sister or brother. Why try to change only your husband and wife? Because that is the reality. That is the reality.
That is very important to be included in the premarital counseling, actually.
I
The
always
most
say that.
important part.
And I keep saying that how my fantasy has changed over the years. I tell all the girls the fantasy has come and start with this one. So somebody asked me, so how long this will last? I said, I'm not sure. Maybe 1 month, maybe 1 year, maybe 2 years, till I find the next one. So fantasy is sort of the energy that keep you going on. But stability is given by reality. Reality never change. And at the end of the day, you realize fantasies never make you survive. It is only reality that make you survive. I think that need to be told to the couple.
To the couple, definitely.
Dr. Kalyani wants to ask something. Dr. Kalyani, please.
You can unmute yourself, ma'am.
Huh? Who is Dr. Kalyani?
She was raising her actually.
Acha, but she's
maybe she has left. Dapke sir is there.
Dapke sir, thank you for being all the time with us. Thank you so much.
Dapke sir, आप unmute कर सकते.
I am here to learn from all of you. So
vice versa, sir.
Very nice friend. I have one problem. I don't think in these 7-8 lectures it has been discussed. And this problem, since we are talking of adolescents, there is a situation which was not there 10 years back. At present, like all big cities, say, let us say, which are having 10 lakhs and plus population, have medical, engineering, other colleges, and lots of students are coming from villages and small places for education. Now, this story is not ending here. What is important is these colleges or institutions don't have hostel or residential facilities for these students. And the best scene which if you just living in a colony where there are road and houses both the sides and true 3-storied buildings, even 10 to 15 buildings have a small chit outside saying that hostel for boys. There is another which hostel for girls. Now there is nothing wrong in that, but what is the next step which is bothering is now these boys and students, they are under nobody's control. And in the evening, we see so many boys and girls walking, moving, and I don't know whether this is right, whether this is correct. What should we tell to these boys and girls? And sometimes their walking behavior, talking, when you see from outside, it looks little abnormal in sense there may be abnormal relations in couple of them. And how to prevent this or what is the solution for this? Because this is problem in thousands. Even a city like Indore, even the colony where I am staying, there are at least 10 hostels like this for boys, 10 for girls, and we don't know what should be the step to prevent whether.
So before Preeti adds, sir, just wanted to say that it is definitely as parents and elders, we all are very concerned about the young children because we always feel protective about them. That ki kya ho raha hoga, how what is happening, and when we see these children who are away from their homes and all independent, and we have to be most. I think it's more necessary now since most of the children are going outside their homes for further studies. It is all the more necessity that we give them life skills because that age itself is at high risk behavior will be there. They are very prone for exploring and so there is a risk. But at the same time, we need to empower them with life skills, make them understand the body changes, the feelings of attractions may come in, that's normal. We should not be judgmental that it is what is normal, abnormal. Nowadays, in progressive thinking, we do not blame them or do not tell that it is wrong, sort of abnormal behavior, as jo humko lagta hai. So, which is normal behavior actually, and make them feel it's okay for them to talk and mix with all these types of genders. So like we see in some societies abroad, it is very common for them, boys and girls mingle quite early in life. So they do not get, they do not have those problems what India faces. So we somehow separated them for a long time, and then when they try to have that independence away from parents and little freedom, and they are not exposed to the opposite sex. So then they have more high risk behavior. So it is nice for them to intermingle, but the life skills should be given to them, and the basic things like respecting, consent, and being non-violent. All these things which Dr. Preeti has mentioned. So all this has to be very strongly told to them, and of course laws are there, and this definitely said this age is the experiment. But it's okay, we cannot always be protective and be behind, taking care.
Problem is who will do this? Because these are in thousands and
yes, sir. So we can do a bit by bit. All of us have to take, little roles, and it is schools, college. We should start in the schools. The schools is where before they come to these colleges, they are in the schools. So in the school is the best platform for them. We need to tell them what is life beyond the school and what are the things they may likely to face and how to deal with them. The school is the best place. That is my opinion.
Thank you. Thank you. Thank
So
you.
that's a great question, sir, because as we are seeing, we are becoming a much more sexually permissive society with time. And I think I talked about the windows of sexual behavior, and I would strongly recommend everybody to go through that manual, which tells the window approach, window 1, 2, 3, 4, 5, 6, which tells exactly how you could make a decision regarding, like I said, happy, safe, healthy, and responsible sexual behavior. So that's important. As Bindu said, yes, schools is a good place, but I again emphasize and re-emphasize that college also is a fantastic place. This just telling them once is not enough, sir. We have to emphasize and re-emphasize again and again. So all colleges should also have life skill based education, and also then premarital counseling becomes a very important component because of in college based. So that also comes. We may not talk too much about premarital counseling in the school age because they're still younger, but we emphasize on health. Health is so very important. But in college, definitely we would say sexuality education with premarital counseling should be the way in college. And I think AHA now needs to shift from just limiting themselves to 18 years because we see the problems in young adults are more. And as you rightly said, they move away from their home and there is nobody to monitor them. At least when they are in school, they are at home. The parents are there to monitor. When they go into a college kind of a situation and they're staying in a hostel, that monitoring is not there. And we know that the brain is still not fully mature. So the chances of high risk behavior stay till 24 years. So all the more reason that our clinic should be open till up to 24 years. And we should be going to colleges, not only schools. And that's important.
Agree with totally with Dr. Preeti that this is more high risk actually beyond school. College and university should also be covered, and so that they are, we equip them with knowledge and skills to how to deal with these challenges of that age.
Very important
yes, sir.
additions. And I think if they are not in hostel, they are not in home, there should be some person responsible for continuously communicating them from the teaching institution, whichever branch they are studying, because most of the teachers, they are so high level teachers, they think that is not their job. And that is what happening in some residents, and I should say because their behavior is very abnormal.
So I just want to mention, because now I'm heading a medical college principal, and all our students of NMC is also brought in. The teachers are not just for taking classes.
Yes.
So our medical teachers also given this role of a mentor, and each one of them have to take care of some 5 mentees. So we have 1:5 ratio. So then the teacher has to be in communication with the mentees and talk to them often communicate to them, and they share their numbers, and the students can actually openly talk to the teacher. Of course, we have to maintain those confidentiality and other things which we are these are as a counselor. So those things are already come into the education, sir, because I think the need of the day. So NMC, at least in medical college we're doing, I think the same has to happen in all education system. So where the teachers can be the mentors themselves.
Yes, very nice, very important. I think this should be a big project, and a adolescent society should
mental wellness, sexuality, all those things they need to now the teachers have to take care, and we have to, the HS also come out with a teachers teach module and many things we are doing, sir. So there's so much to do. All of us, I think we all can come together and get in new ideas to deal with all these new problems.
Thank you. Thank you. Anyone else would like to comment something? Geeta ma'am, Madhushri ma'am, Thakur sir.
Namaste, madam.
Yes, please.
Yeah, this is Ravi Bhargava from Andhra Pradesh. So, I think Madam rightly said, actually, till now I had a very broad, very narrow mind on prenatal counseling. But Bindu Madam made me to know it's a broad spectrum. So, thanks, Madam, for that. Because, till now I felt that, it's before marriage. But as you said, it's a health point of view. And, it's how to, it's like how to maintain relationships. Because as you said rightly, that is at age mainly 16, 17 years, they start thinking about, other sex what you call attraction, more on
Attraction,
part.
yes.
So this is I felt you talked about mainly it's relationship management, how to choose a perfect relation. So I think you made me, it's a great day, madam. I learned this from you. Thank you.
Thank you. Thank you, Dr. Ravi Bhargava. Thank you.
Madhushri ma'am. Amar Singh Thakur, sir.
Yeah, it was fantastic, Madam Himabindu. It was something like very new subject, and I was thinking what Mr. Ravi Bhargava reflected in the same line. When I saw your name that you will be speaking on premarital counseling, but it is altogether different. So it was very nice to learn, and I think we will implement wherever it is possible.
Thank you, Thakurji. Thank you.
It was fantastic. As usual, you have been like a star speaker, and it is always hearing you is something kind of feast. So thank you very much, both of you.
Thank you, sir.
Thank you.
I should thank Dr. Geeta, Preeti, and also Kavita to choose this topic in the schedule in their this very well attended sessions. Thank you. This is an opportunity for getting the knowledge on preconception care, and thank you, the IAP Chhattisgarh and AHH Chhattisgarh. Thank you so much. I really enjoyed being with all of you. I hope
Thank
this
you, ma'am.
actually gets implemented at the ground level.
Thank you, ma'am. Thank you. So should we conclude now? Geeta madam?
Dr.
Malini madam?
There is a question.
Yeah.
The chat box, yeah.
What is it?
What is that question?
Not able to see.
Question is, should the adolescent be warned about hepatitis B and HIV being transmitted by kisses, as you cannot protect them? Should the adolescent ask partner for tests?
Actually, you have a right to protect your own body. So it is definitely, I think they should not, with due respect, these things can be known by the partner before they go for sexual intimacy. Whether they are having any carrier state or HIV, STIs, all this need to be told to if they really love their partner, if they really care for their partner, like Dr. N.K. Sinha has said, and respect, and I think the partner should be open about all these things. So they have to communicate. It's a right for the partner also to know.
I'm like nowadays are trying to make it mandatory to show the status of thalassemia and sickling in their matrimony. Should we promote the show the status of STIs also in the
actually it's a very
matrimony?
sensitive topic, Dr. Kavita. Still,
definitely it's very sensitive topic.
It can have a lot of problems right now, but I think we should go slow and try to talk about it and encourage those who are youngsters, who are now youngsters, present day generation are very open, and they can imbibe all this respecting each other and all that. So, but our old timers may not like this idea of putting it as one of the checklist. So let us go slow, and definitely we should get in at least after some time. But then let us now at least start talking about it and encourage the young adults to ask about all these things.
Promotion of safety methods at colleges and schools is very important. That would, I think, solve the purpose. Dr. Meenakshi wants to say something. She's raising hand. You can unmute yourself, ma'am.
Hello, ma'am. Am I audible?
Yes.
Yes.
Yeah.
Yes.
Ma'am, I have a question regarding this live-in relationship. How to talk with a adolescent who is, inclining towards live-in relationship and rejecting the marriage concept of, getting married. And so how to just give me a little, glance.
Can Preeti, can I answer this? No, actually, there's nothing like hard and fast rules for this. I think it's all individual. First of all, as adolescent experts, we are professionals. So we need to respect the adolescent's choices, and we need not be judgmental whether this relationship will end in marriage or not. As parents and elders, we are really concerned. We do not want our adolescents to have multiple sexual experiences. So we think that some relationship should end in marriage. So we think like that. But for an adolescent, it could be different. So they would like to live for some time with somebody, and then they may move into more marriage or they may move out of this relationship. So it is their individual choice. So as professionals, we need to accept that it is the individual choice of the adolescent. But only thing is, as we say that maturity and all that 24, 25, but during this period between that, when they become sexually active until they decide what they want as a future committed relationship. So that is a high risk period, but we need to support them through this life phase also, through life skills and other things what we said. But we cannot push our ideas on them saying that कि आपको ये नहीं करना है. So like in abroad, in many countries, this is already there as part of their social structure itself. It is accepted as a normal thing. And but in India, it's still not, we are still hesitant to accept it. But these are going to come maybe. So but ultimately, I would say as professionals, as adolescent specialists, we need to accept the choice of the adolescent. And also, but empower them with the consequences, with their, help them with decision making, and tell them of pros and cons, and ultimately leave them, at least they should be safe. They should be safe sexual behavior. They should not be violence. They should not be gender-based violence. What is happening, if they are safe or not, at least that much we should ensure. So if they are not safe or something else is there, then we can report to the parents or others, as we already do in other circumstances. That is my opinion. Others can comment on it.
Maybe absolutely right, ma'am. Absolutely
Can
right.
I just say one point? So, Meenakshi, the first thing is adolescents. You use the word adolescents and live in relationship. Here definitely get the law into the picture, and we know that the age of sexual consent is actually 18. So, of course, you will talk to them about all the windows. Like I'm again and again saying, those window approach is extremely important. In the end, you'll also end up with the laws. So that's important. Now, I presume that you're talking not about adolescents, but you're talking about young adults, right? So that they're above 18 and you're talking about them. Now, when you're talking about them, you must, kind of brainstorm with them health consequences, social consequences, legal consequences, and economic consequences. So all these four aspects have to be talked in detail, right? What if you get pregnant? What if there is a child? What will be the legal status of that child? Will that child be legitimate, illegitimate? Are you going to have a joint bank account, or are you going to have a separate bank account? So if something happens, God forbid, if you buy a property together, what would happen? What will be the, what will be the status of that property? So I think all these, it is actually very, very detailed, and I don't think we still have that expertise to handle. But from what I can say is, you must get the legal also into the picture, which is very, very important before they take such a decision of really moving in together. So these are my two thoughts about it. Yeah.
Oh, thank you so much, ma'am. Both of your inputs covered both adolescents and early. Yeah,
So
thank you so much.
thank you, everyone. This was really wonderful session. Thank you, everyone, for this phenomenal spellbinding session. And with this, we successfully completed our 8th session. And our series is now reaching to its end. And next Sunday would be our final session. And I would like to mention that this is going to be a whole day session. It will start from 10 a.m. to 4 p.m. And the speakers would be our international deputy speakers, our always favorite Dr. M.K.C. Nair sir, and Shekhar Shishadri sir, he's international deputy. I think you all know much more than me to him. So he'll be taking the full day training on trauma and child abuse. So mark your calendar and spare your time for the whole day next Sunday. And with this, I pay my gratitude to our guest of honor of today, Dr. G. Malini Madam, our speakers, Dr. Himabindu Ma'am, Dr. Preeti Madam, for wonderful, wonderful sessions. And it was really a wonderful interaction. And Dr. M.K.C. Nair sir, as always, he has been, I always call him adrak in the chai. वो चाय पीते हुए भी देखते हैं. So he's the flavor of adrak in the conference. So thanks a lot to Dr. A.P. Sawant sir, Dr. Namita for a wonderful chairing the session smoothly. And thank you all the respected office bearers on the platform and off the platform and lovely audience. I always get so much good response, so much good number of the audience. Really thanks to all of you. So last thanks to to the team mayor for arranging the technical part. Thank you everyone. Rapkesh sir, Geeta Patil madam, Amok sir, Swati Vakmare ma'am, Atul Kanikar sir has also been very always, I think he has joined almost all the sessions. Nishikant sir, everyone, thanks a lot. Amar Singh Thakur sir, Madhushri ma'am, Sawant sir. So thanks a lot to each and everyone for being here. Thank you, thanks a lot. And have a happy Sunday.
Thank you.
And the success of this entire series is on all the audience who has been here every time. Thank you, ma'am. Thank you, sir. Thank you.
Bye.
Have a happy Sunday. Thank you.
Thank you so much. Thank you.
It was really a wonderful session, ma'am. Good interaction was there. Thank you.
Yeah. Very hot topic.
Yeah. Really hot topic. The time is actually too short. Geeta Patil madam is here.
I would have done for 1 hour also, but since you said 30 minutes, I had to cut down and maybe sit down. Yeah.
Geeta Patil ma'am, thank you for being always with us. Thank you.
Geeta Patil ji, thank you.
Thank you. Good day.
Good day. Good day.